It's a very distinct pleasure on the behalf of 3ie's to welcome you to this conference. It is titled Promoting Latrine Use for Swachh Bharat. Open-defecation, as you all know, is a persistent health and also safety challenge. In 2015, which was at the time when we started considering this research program, whose results we will be presenting to you today, 60% of those who openly defecated lived in India. Now, 3ie's, with the support of the Gates Foundation, took up the challenge of starting an evidence program to identify effective, low-cost approaches that would draw on behavioral science to improve latrine use. We were particularly fortunate that this program was being carried out at a time when there was great government interest in sanitation. As we all know, the Swachh Bharat Mission has made rapid strides in significantly increasing latrine coverage and use. This also seemed to be an opportune moment and time because increasingly both the government of India, governments around the world, and also donors were discovering behavior change and behavior science as very important factors that needed to be in place to ensure programs like these ones actually are effective. The UK government, for example, has a nudge unit in place to inform policy in the UK. And recently I've heard that the Niti Aayog has been talking about setting up a nudge unit and integrating behavior science into policy decisions. There's a slide up there, which I will talk a little bit to, which relates to our program that we will be discussing today. So in 2016, 3ie's partnered with RISE and also with the Gates Foundation, as I mentioned, in promoting latrine use in rural India and an evidence program on this. The aim of this program is to generate evidence on the effectiveness of behavior interventions to improve latrine use and explore how latrine use can be measured objectively. In the first phase, you see to the left up there, we carried out a scoping study. This is something typically we like to do in 3ie's to understand the lay of the land before we start any evidence program. And this showed that latrine use is influenced not just by access to a toilet. There are several behavioral factors, including social norms, that prevent people from using the toilet. Going out in the open with fresh air is often seen as cleaner than going into a stuffy, smelly toilet. Latrines may not be used because there is fear of the latrine pit filling, and then who and how do we empty it? And these are just some of the multiple factors that affect use. We wanted to support studies that would generate insights into context-specific behavioral drivers. So in the formative phase of this research, we had 9 teams carry out pilots of behavioral interventions in 8 states in India. And these pilots basically showed probably something we could have known, but really brought it out, which is that the contexts in these states are so different. So the latrine coverage and use varied. Barriers to using the toilets varied. So from that first phase, the scoping, the 9 formative evaluations, we then selected 4 teams, the most promising approaches that we had uncovered in the formative phase, to carry out impact evaluations in 4 states: Odisha, Karnataka, Bihar, and Gujarat. And these tested different interventions focusing on households that owned latrines. In addition, we had an independent measurement team that worked with subsamples in each of the 4 project areas to test the validity of different latrine use measures. As some of you may know, the surveys like DHS, NFHS, etc., rely on self-reporting of latrine use. Self-reporting is prone to what we call social desirability bias. You answer what you know is expected of you to be answered. Or at least there's some amount of that. There's also other problems. There's unprecise questions. There's average questions. How do you average everybody in your household over how many weeks, months, etc.? So a lot of issues relating to surveys. So these are the studies, and we're very excited about this, that will be presented to you today, the results of these 4 studies. And we want this event to be a platform for open discussion with all WASH stakeholders, all of you. So I think we have in the room, for sure, implementers, donors, researchers, and the government to discuss the future of sanitation in India. So, for example, what should we be focusing on in post-SBM era? What should be the focus? Or what can we ensure how can we ensure that latrine use is sustained? So, ladies and gentlemen, very much looking forward to engaging with all of you today on this important topic. And before, I will go back to some more logistical issues that I will come back to later. But first, I would like to hand over to my colleague, and I was going to say partner in crime or something like that, Radu Ban, who was a very dedicated partner in the Gates Foundation throughout the program, to also give some welcoming remarks. Thank you.
Good morning. My name is Radu Ban. I'm a senior program officer with the WASH program at the Gates Foundation. And it gives me great pleasure to welcome all these people who are interested in learning about open defecation. In fact, I remember being in a similar room, but in a different hotel, about 3 years ago. And at that time, I remarked that the name of the hotel was the Eros Hotel, the Greek god of love. So it seemed so poetic that we were all in a room at the Eros Hotel talking about open defecation, right? Now, today the name of the hotel is less poetic, but it's so good to be, 3 years afterwards when we can actually talk about what we learned. But just remember that it all started with this idea of love. And open defecation. Now, within the sanitation space, as most of you know, the reduction in open defecation is one of the interventions that has the most evidence behind it. So we know a lot about what happens when you're able to reduce open defecation, right? We know that if you reduce open defecation, kids grow up to be taller and healthier, and they're also less likely to die in their first year of life. And that is particularly true in areas with high population density, as is the case throughout most of rural India. So being able to reduce open defecation in this highly dense population is really one of the most impactful interventions that one could do if one cares about the lives of kids. So with that motivation in mind, the foundation partnered with 3ie's to really learn, okay, what are some interesting and innovative interventions that can be promoted to accelerate the rate at which open defecation is reduced. And Marie already talked to you about how this happened, what the program was. I'm not going to go back into it. But I will just add that, of course, our work with 3ie's did not happen in a void. It happened here in India, where a lot of effort has already been put in trying to reduce open defecation with demonstrable success over the last couple of years. And that is good. It also, for the people that really care about careful measurement, it's a challenge. It's probably a good challenge to have, but it remains a challenge if you really want to know what specific interventions work, if so many other things are working to help the same problem. But I will let the researchers in the room give you more details about how they dealt with that problem. Now, just to sort of lead into the next session, I think all the work that has been done here by all these teams will be even more valuable if it ends up influencing policy. So that's why we're so excited to have here many people whose day-to-day life involves making decisions about what happens at the ground level. So I encourage all of you to pay close attention, to think about what are some of the things that you can take away from these 4 studies. The teams that have worked so hard are all here, so I encourage you to engage with them, ask them questions, because that's really how we get more value for the time and resources that are spent to put together these studies, if they are taken up and they end up influencing decisions.